Happy morning to Miss Horizon Chaser.
Alright, ma'am. So ano po yung gagawin natin doon sa mga malalaking company na meron na po, may trans fat po yung kanilang
They have
produkto?
to reformulate based on the administrative order and the circular of FDA. So, nandun naman may guidelines po. And they're given 2 years from the time it was signed last year. So, they have until June 18, 2023, next year, to, when you say reformulate, to change the composition of their product. So, yun. So, pag hindi kasi, and FDA will monitor products into market and it will be tested for trans fatty acid. So, pag may makita po yun, then as the regulatory agency, meron naman kaming mga sanction. O pwedeng, usually kasi ang mga sanction na yun is they can be recalled, tatanggalin sa market, and you're not allowed to distribute or sell pag hindi ka nag-follow or nag-comply sa administrative order na yun on trans fatty acid na bawal mag-produce, bawal gumamit. So, meron pong guidelines na.
So ngayon po yung mga bago po na mga produkto na bago ngayon, sinimulan nyo na po yung paghihigpit na yon.
Hindi pa namin, kasi may transition eh. So, full implementation talaga is June 18, 2023. After that, doon yung full implementation. So, doon na mag-ano si FDA.
So ngayon pa lang dapat.
Ngayon, i-advocate ko, i-inform ko sila that they have to reformulate na because they should be by 2023 ng June. Wala na talaga pa.
Alright. So ma'am, ano pong mensahe lang po dun sa mga tumatangkilik ng mga merong trans fat po? Bukod sa nabanggit nyo na po kanina, yung, lalo na po yung mga baguhan ngayon na nag-iisip na magnegosyo.
I think ang advice ko lang, para hindi
Ngayon pa lang.
Ngayon pa lang, simulan na nila mag-formulate ng products without that ingredient, yung without trans fatty acid. Industrially produced trans fatty acid as one of the ingredients because kung hindi man agad-agad yan mahuli, hindi naman mahuli, ng FDA, then hindi naman maganda na you will be sanctioned because you didn't follow. So, hassle din kasi yun eh. So, might as well follow what's stated in the regulation or in the FDA. So, para smooth ang negosyo.
Thank you so much, ma'am.
Isang masustansyang umaga at isang masustansyang araw, Miss Horizon.
Ma'am, pakisuyo na lamang po dun sa mga, sige.
So, unang-una, tayong mga ordinary people, especially ang ating mga kananayan, na siyang naghahanda ng ating mga pagkain. Kung meron po tayong mga gustong malaman tungkol sa tamang pangangalaga, sa tamang nutrisyon, pupunta po tayo or maghahanap po tayo, magsisik tayo ng tamang informasyon from the reliable sources, katulad sa NNC at katulad sa DOH or sa World Health Organization. Meron po kaming mga IEC materials, may mga audiovisual materials din po kami na nagsasaad kung ano ba ang tamang diet, ano ba ang healthy diet, ano ba yung 10 commandments na dapat nating sundin para sa isang malusog na pamumuhay at tamang nutrisyon. Sa local level naman po sa ating mga community, nandyan po yung ating mga barangay nutrition scholars, ang ating mga barangay nutrition volunteers na siyang magsasabi po sa atin, na siyang gagabay sa atin. Ano ba yung mga dapat nating kainin? Ano ba yung mga dapat nating itanim kung gusto po natin mag-start ng ating mga home food gardening, no? At andyan din po yung mga interagency na membro po ng ating mga local nutrition committee para magbigay po ng mga nutrition services na merong tamang kalidad at sa tamang pamamaraan at sa tamang oras ng kanilang pagsiservisyo sa atin. So yun lang po, yung tamang nutrisyon po, dapat talaga alamin natin, gawin natin at ipamahagi po natin.
Ma'am, anong masasabi niyo sa mentalidad ng mga Pilipino na kapag po pumili ng pagkain, sasabi na, ang arte-arte mo naman, lalo na po sa mga party, ganyan. So ano pong may papayo natin?
Yun po sa mga naman nagsasabi ng may mga bashers, minsan tayo, nandiyan natin may iwasan na, arte mo naman, gusto mo pa, diet-diet ka pa. Hanggat maaari po, kung may mga ganun po tayo mga kaibigan, kapamilya na nagnanais na kumain, at mag-healthy diet, supportahan po natin sila. Kasi sabi nga natin, ang tamang nutrisyon ay isa sa mga magandang prevention para tayo magkasakit. Supportahan natin yung ating mga kaibigan na gusto mag-healthy diet, na gusto maging health conscious kasi para naman din yun sa kanilang ikagaganda na kanilang kalusugan at na kanilang mental state na din.
Nandito tayong lahat because it is Nutrition Month and because we are here to call for your support to prioritize and promote heart health. Alam niyo po, last year, no, in 2021, amidst the COVID-19 pandemic, cardiovascular disease or heart disease remained to be the leading cause of death of Filipinos. Alam niyo po ba na last year alone, more than 130,000 Filipinos due to heart disease. And what's sad about this is that heart disease is preventable. And we say it's preventable because it has lifestyle-related factors that are modifiable, katulad ng diet or katulad ng mga kinakain natin. And in 2021, the Department of Health and the Food and Drug Administration paved the way to make the Filipinos' food supply more nutritious, more safe and healthier for our hearts. Last year,
Pilar Pagayunan from the Food and Drug Administration, Ms. Jomai Tonggol from the National Campaign with the ultimate goal of making healthy behaviors the easier choice for everyone, every time, and everywhere. We not only are we take care of their health, and in terms of nutrition, our job does not end by just letting them know what proper nutrition is or by telling them what to eat or what not to eat. Our mandate extends to ensuring that there are mechanisms in place that will safeguard them from unhealthy additives like trans fat, acids, or TFA. So kung ano yung nabibili nila, dapat mas healthy yung available. In the Philippines, we know that non-communicable diseases such as cardiovascular diseases have been one of the leading causes of death. And according to WHO, 2.64% of deaths from coronary heart disease or blockage from the heart's blood supply are due to fatty substance buildup in our coronary arteries. This could also be attributed to TFA intake. So, yet, we know that TFA is used in various prepackaged food products. So to address this, the DOH, with the help of our colleagues in FDA and NNC, we issued Administrative Order 2021-0039 prohibiting the production, importation, distribution, and sale of products with industrially produced TFA. This issuance is supported by our ongoing campaign for Filipinos to adopt the 7 healthy habits, which include nutrition and physical activity, as well as our joint promotion and advocacy efforts for TFA elimination that we are working with all our partners today. So to successfully shield our people from TFA, we will need the active participation of different sectors of our society. We are calling on fellow health and nutrition professionals to help raise awareness and alarm on trans fat and its linkage to cardiovascular diseases, to increase also the demand of the public for removal in the food supply, no? Na mawala na po siya sa food supply natin. We are also welcoming the support of the passage of a law that will prohibit the sale containing this additive. So, pero hindi po nagtatapos, no, yung trabaho po namin sa pag-alis ng TFA sa problema ng malnutrition and non-communicable diseases. Ang Trans Fat Free Pilipinas, it's just one of the big steps tungo po sa ating ambisyon na Healthy Pilipinas. Tuloy-tuloy lang po tayo sa pagpapaalam sa publiko ng masamang epekto ng TFA sa ating kalusugan at pagtataguyod na maisabatas po ang permanent na pag-alis po ng TFA sa mga pamilihan. Sama-sama nating protektahan ang mga Pilipino, lalo na ang pusong Pinoy, para po sa isang Healthy Pilipinas. Maraming salamat po.
Maraming salamat, Dr. Ho. We stand firm, Dr. Ho, behind the DOH, Director of the Center for Food Regulation and Research. Thank you, Dr. Ho.
Thank you for your time.
Let me allow to read my statement of support to the Trans Fat Free Philippines PINAS 2023 So as the nation celebrates Nutrition Month, this July, the FDA expresses its full support to the Department of Health's campaign of eliminating industrially produced trans fatty acids from the food supply to prevent and control non-communicable diseases. The FDA recognizes the crucial role of food business operators, compliance in achieving the country's goal of eliminating industrially produced trans fatty acid. And we have issued the FDA circular, as mentioned earlier by Dr. Grupo, the guidelines for prepackaged processed food products, industrially produced trans fatty acid in the country's food supply to prevent NCD. The circular also likewise guides the food business operators that are producing prepackaged food products, which is expected to last until 18 June of 2023. Thereafter, the FDA will include monitoring of those prepackaged food products in the market for determination if they contain industrially produced trans fatty acid in fats, in oils, and other processed food. In the Center for Food Regulation and Research annual post-marketing surveillance plan, because every year we are drafting for the annual post-marketing surveillance. We collect samples from the market to test these products in accordance to our required testing parameters, so depending on our target. So by 2023, with this elimination of the trans fatty acid from the PH food supply processed food products, so trans fat testing will be implemented. So to check the presence of trans fat in the processed food products. So we will be engaging our regional field offices, inspectorate, to collect sample, and we also have to comply. We have also engaging our food laboratory to check the compliance of the food business operators to ensure that the industrially produced trans fatty acids is no longer in the market's processed food supply chain. Otherwise, appropriate regulatory action shall be imposed by the FDA. So, maraming pong salamat at magandang umaga po sa ating lahat. Thank you!
Wala na tayong makikita sa ating grocery and retail stores na food products with trans fat or industrially produced trans fat. Maraming salamat po. We now move on to hear the statement of the National Nutrition Council from Ms. Jo Marie Congon. Palakpakan po natin si Ms. Jo Marie.
Isang maganda and happy Nutrition Month for Azucena and Dayang Hirang, MD-MCH Session. Sasalamin lang po. So the message says, the National Nutrition Council, as the highest policy-making body on nutrition, supports the launch of PINAS 2023 Trans Fat-Free campaign in response to our call for multi-sectoral collaboration to develop strong interventions that will improve Filipinos' nutritional status. This campaign will progressively eliminate industrially produced trans fatty acid in the Filipino diet. Eliminating TFA in the food system has been identified by the World Health Organization as the most cost-effective and direct public health intervention to improve our diet and reduce the risk of non-communicable diseases. As we have a new administration, the National Nutrition Council is formulating the successor Philippine Plan of Action for Nutrition, or PPAN, for 2023 to 2028 as our next blueprint for improved nutrition situation. The PPAN will continue to espouse the adoption of healthy diets to address malnutrition, including overweight and obesity and non-communicable diseases such as heart disease, cancers, and diabetes. Today's launch on trans fatty acid elimination campaign is auspicious. This is very timely and relevant, as we also celebrate the 48th Nutrition Month with the theme, New Normal na Nutrisyon, Sama-samang Gawan ng Solusyon. One of our key messages is, good nutrition is key to building immunity. Siguraduhin ang tamang nutrisyon para sa malakas na resistensya laban sa sakit. This pandemic taught us more than ever the importance of nutrition as our first line of defense in any kind of disease. Eating a healthy and well-balanced diet, using the Pinggang Pinoy as guide, consuming foods that are rich in vitamins A, C, E, B6, and B12, such as citrus and dark green leafy vegetables, and maintaining an active healthy lifestyle, and drinking 8 to 10 glasses of water every day are just some of the steps that one can do to ensure good immunity, protect ourselves against illness and infection, and support recovery. Today, we continue to give our unwavering support to achieve a trans-fat-free Philippines by 2023 to ensure improved health outcomes of every Filipino. We are still in the transition to a hashtag trans-fat-free 2023, but as early as now, we can start choosing trans-fat-free foods to keep our hearts healthy and be hypertension-free. We strongly urge everyone to be involved, make a difference, and be one of us in this campaign of eliminating trans fat in the food system. Again, sama-sama natin gawan ng solusyon ang new normal na nutrition, and together, we move forward for nutrisyong sapat para sa lahat. Daghang salamat, and may God bless us all.
Attorney Sofia Monica San Luis.
Pretty good time to look back into the lessons of the pandemic. We have learned a lot from the COVID-19 pandemic. It has exposed the weaknesses and limitations of our health systems. We have seen how those with comorbidities are at a greater risk in the face of infectious diseases. We have also learned that prevention is truly better and altogether more effective than cure. With all that we have learned, we've also seen how it is high time that we prioritize policies and activities that will protect our heart and our health. As of today, heart disease remains to be the leading cause of death for Filipinos. And as we strive to build back better, we urge the new Philippine administration to create a food environment that promotes healthy choices for Filipinos. Eliminating industrially produced trans fats brings us one step closer to building a healthy and resilient Philippines. We stand with the DOH and FDA in its commitment to implement DOH AO number 2021-029 and its succeeding administrative orders and circulars. We will only achieve our vision of a healthy Pilipinas if we achieve our goal of a PINAS 2023 trans fat free. We urge the food industry to rise to this challenge of building back better by showing their commitment to consumers' heart health by removing industrially produced trans fats from their products by June 18, 2023. We also call on the President, President Ferdinand Marcos Jr., to prioritize Filipinos' heart health by certifying as urgent the Trans Fat-Free Philippines bills filed by Senator Nancy Binay and Congresswoman Annabel recently. Trans fats are both ubiquitous and insidious. It is everywhere, and yet the public do not know that it's there. This needs to change. Trans fats have no health value and are completely replaceable with healthier alternatives that are already in the market. Once passed and enacted into law, the bills that were filed by Senator Binay and Congresswoman Matiba will remove industrially produced trans fat from food sources that are outside the FDA's jurisdiction. These will include food products sold in food establishments like restaurants and traditional and informal markets. The bill will also mobilize much-needed resources for additional laboratories and facilitate duty-free importation of testing reagents and standards for detecting industrially produced trans fats in food. This legislation will ensure the complete elimination of industrially produced trans fat from the Philippine food supply. Thus, we urge the President to lead the united call for a healthy Pilipinas by advancing a trans fat-free Philippines by 2023. Let us truly build back better by investing in our people's health. Thank you.
Ka-partner ay ang Nutritionist Dietitians Association of the Philippines. May I now call on the National President, Dr. Zenaida Velasco.
Ayan. So let me read my message. Babasahin ko na lang po, no? So COVID-19 has brought to center stage the most important health issue of our era, largely ignored by policymakers and the public today. And I'm referring to the non-communicable Filipinos attributable to heart disease or CVD. Can we answer 30,000 deaths a year of Filipinos? And therefore, people living with NCDs or non-communicable diseases, especially those with cardiovascular disease, are at a very high risk of severe symptoms and death from COVID-19. As a result, for policy measures to protect cardiovascular health. And one example of how we could help in the prevention of CVD is the elimination of industrially produced trans fatty acid. Sabi nga natin, the removal from the global supply could prevent up to 17 million deaths by 2040, and would be the first time an NCD risk factor has been eliminated. So when you think of the pandemic, people also talk about the syndemic. Here we see the parallel epidemics of health problems which would interact synergistically with COVID-19. So it is imperative to prioritize, invest in public health by adopting health-promoting policy measures, including industrially trans fatty acid elimination. Alam niyo po, ang talaga pong nahihit nitong cardiovascular disease comes from the lower socio-economic status, and they're really at risk for cardiovascular disease. Now is the opportune time to call the new President of the Republic of the Philippines, His Excellency Ferdinand Romualdez Marcos Jr., to put in place the Trans Fat Bill, which could save many lives, ensure our economic gains for the country, restore peace and prosperity. In the now normal, I call it the now, and in the new society, let us relentlessly put our efforts in eliminating industrially produced trans fatty acid. Mabuhay po kayong lahat. PINAS 2023, pakisigaw po. Trans fat free. Ulit po. PINAS 2023, trans fat free.
Representative Office in the Philippines, Dr. John Juliarco. Palakpakan naman po.
Thank you, Attorney Mahan. We are fortunate, of course, that OIC, USEC, Beverly po to all of us. Industrially produced trans fat causes heart diseases and deaths and has no known health benefit. And yet, it's still used in many countries, Philippines included, in baked and fried foods, prepackaged snacks, and certain cooking oils and fats that are used at home, in restaurants, or in street food. These trans fats can be replaced with healthier fats and oils without changing the taste or cost of foods. WHO supports the Philippines in its efforts to eliminate industrially produced trans fat from its food supply by 2023. Trans fat elimination is a priority for WHO for 3 reasons. First, it will save lives. Second, it is feasible as evidenced by the experiences of implementation in Denmark and many other countries around the world. Third, it will prevent heart disease and will reduce the burden on healthcare facilities at a time when COVID-19 is already taking a huge toll. For WHO, eliminating trans fat has been a focus of work for several years now. In 2018, we launched the Replace Action Framework, followed the next year with detailed operational guidance and progress reports to inspire and help government in eliminating trans fat. WHO is now planning to implement a validation program for trans fat elimination to recognize countries that have eliminated industrially produced trans fats from their national food supplies. We at WHO commend the Philippines for rising to the challenge of trans fat elimination with the issuance of the DOH Administrative Order on Trans Fat Elimination and the concurrent legislative measures that are planned to be filed and discussed in Senate and Congress. WHO remains committed to assist the DOH and partners in implementing this very significant policy that will save many Filipino lives and contribute to the improvement of the quality of life of others. We thus urge the new Philippine administration to prioritize heart health promotion through trans fat elimination and encourage all stakeholders to support and work together to reduce premature deaths from cardiovascular diseases and other preventable diseases, and for all Filipinos to live longer and healthier lives. Trans fat elimination saves lives. Together, let's achieve trans fat PINAS in 2023. Magandang umaga at mabuhay po tayong lahat.
Very much. Ayan, maraming salamat.
Ng coffee, yung 3-in-1 contains yung cream, no? And this type of formulations, may trans fat content yan. But in addition, there are other ingredients of coffee as well, di ba? And yung formulation ng coffee natin minsan, ang taas ng level ng sugar as well. So I think the principle always for all of us is that we really need to choose healthier food options always.
Yeah.
And we can avoid this type of formulations. And we can choose other formulations perhaps that are healthier. Pwede naman na yung may coffee naman na walang sugar, hindi ba? Parang add sugar to taste and maybe avoid these ingredients that are known to cause harm to our health.
I think overall, yung gusto lang din namin i-remind sa public, always healthier yung whole food, no? Ibig sabihin, we try to avoid as much as possible processed foods kasi yun yung pwede kayong ma-confuse kung ano yung nasa label, di ba? So in general, kung ayaw yung makomplikado, whole food, no? Ibig sabihin, natural siya, nabili niyo siya sa fresh na market, no? Ngayon naman, marami na tayong local coffee manufacturers, kunwari, di ba? And they produce packs coming from different parts of the country. So that would be a sort of an easier guide for the general public.
Thank you, Dr. Ho. Mas